Many people believe that tuberculosis is a relic of the past. However, this preventable and curable disease continues to claim over 1.5 million lives per year. Vietnam currently has the 10th highest TB burden in the world, with over 170,000 diagnosed cases each year and over 11,000 deaths. Beyond morbidity and mortality, TB is responsible for driving people into poverty. A national patient cost survey conducted in Vietnam found that after a TB diagnosis, 21% of households fell below the poverty line, making less than $2 per day. To respond to the TB epidemic and associated economic impacts, USAID, in collaboration with the government of Vietnam and local organizations, developed the Erase TB project. Through this project, every individual with drug-sensitive TB in the 10 implementation districts of Hanoi and Ho Chi Minh City was evaluated for the risk of experiencing catastrophic costs at the start of their treatment. A tool was developed to scientifically categorize risk levels and was then integrated into community-based TB care. Doctors, nurses, or other staff members would fill out the risk assessment tool at the district TB unit, where care is routinely distributed. People with TB were then assigned to one of 3 groups, and support was provided based on their level of financial risk. Through the support of USAID, all people receiving treatment in the 10 districts received enhanced education about TB. Those at the second highest level of risk also received transport vouchers when they attended monthly appointments. The third risk group received 2 cash payments on top of additional education and transport vouchers. Data from a previous analysis in Ho Chi Minh City showed that the costs associated with TB treatment were highest during the first 2 months of care, so cash transfers were provided during this time. For those in the third group who did not have access to Vietnam's National Social Health Insurance Scheme, the project purchased 1 year of insurance coverage for the TB-affected household. For 2.5 years, beginning in 2019, over 5,500 individuals began treatment in 10 Erase TB districts. 83% received the risk assessment, of which 22% were deemed at risk of experiencing catastrophic costs. More than 5,000 individuals received enhanced TB education, and over 800 people with TB received travel reimbursement for their clinic visits. Over 700 people received transport vouchers and cash, and 58 households received all forms of support, including 1 year of health insurance coverage. The project ultimately provided economic assistance to 828 individuals with TB.
Từ dự án á, em nhận được một cái khoản về dinh dưỡng cho mình đó, với lại nhiều cái thông tin cần thiết về việc điều trị, hỗ trợ rất là tốt cho cái việc điều trị của em. Em sẽ giới thiệu cho mọi người để mọi người được tiếp cận cái dự án của mình để cùng nhau khỏi bệnh.
Em sẽ giới thiệu bạn bè đến dự án để điều trị bệnh. Em cảm thấy sức khỏe của em rất là tốt. Các anh chị em dự án rất là nhiệt tình và thân thiện, vui vẻ. Em rất là cảm ơn.
The World Health Organization has developed a strategy consisting of 3 pillars to end TB, one of which is addressing the impoverishing effects of the disease using multiple layers of social protection and support. Not all people who begin TB treatment need financial assistance in order to successfully finish their treatment. The Erase TB project identified a way to target the most at-risk individuals, tailor care based on measured need, and then rigorously evaluated the methods and impact of this initiative. In order to mitigate the costs of TB care, innovative strategies such as this are needed to prevent individuals in lower-income countries from falling victim to the poverty trap created by TB.